Good evening and welcome to Athens City Council. It's Monday, October 26th at 7 p.m. and we do have a series of 5 committee meetings tonight, a busy agenda. The first of which is a COVID-19 update, and we appreciate several members from the public and the university sector and our city taking part in the discussion tonight. And we'll have brief presentations from Mr. Jack Pepper, who's the administrator at the Athens City County Health Department, Tom Pyle, known to us as the Chief of Police, and then also now Acting Service Safety Director, our Mayor Patterson. And then also we will be joined shortly by Dr. Gillian. Oh, Gillian Ice is here. Dr. Gillian Ice, who's from the Heritage College of Medicine and is also now serving as the special assistant for public health at the university. So thank you all for joining us tonight. And I don't know if there's any particular order that you want to go in, but the 4 of you each have the floor for a period of time. And then what we'll do is address questions and comments after everybody's made their presentations. I think that'll be most helpful.
Well, I'm happy to start.
Jack, that would be good. For a general overview, I think that would help us.
Yeah, maybe that'll set the stage a little bit. So, first of all, thank you for having me. I think sometimes we forget that we are the Athens City County Health Department, and the city certainly plays a prominent role in the business that we do. So I'm happy to appear before council whenever you guys would like to have an update. So I'm grateful to be here tonight. Just a general overview of what's happening here in Athens at the moment. Of course. We all have sort of sat back and watched what's occurred over the last couple of months with the reintroduction of a student population here in Athens. So certainly no surprise that when you see an influx of that volume of people in any age demographic, for us it just happens to be the student population, that you're going to see an increase in cases. What's interesting is that in the last 3 weeks, we really have started to see a transition from almost exclusively in that 18 to 29 age demographic to spread within our community and spread that is not able to be pinpointed back to campus in some way, shape, or form. So at this point, it's no longer fair to exclusively place blame on our student population. We are starting to see spill over into the community. We currently have a long-term care facility in the county that has 19 confirmed cases as of this afternoon. That escalated from none on Friday to 19 today. So that just is an example of how rapidly, in certain congregate settings, you can see an explosion of cases. This is a very highly contagious disease. We do know that in the younger populations, it doesn't seem to impact them quite as drastically as it does in the older population. So we've been pretty fortunate so far here in Athens that we have not seen a whole lot of death associated with the disease. And I think that can be attributed to how well we've been able to manage our elderly populations. We, as a result of the increased community spread, we, of course, have been in touch with the governor's office as well as the Ohio Department of Health. The Ohio Department of Health has been offering for some time additional testing, which at this point we are going to move forward with. We made that decision today internally that we do feel the need. We had 2 pop-up clinics earlier in late summer, early fall. And they really didn't bear a lot of fruit for us in terms of cases. I think we, on the 2-day total, saw somewhere in the neighborhood of 800 people, and we had less than a half a dozen positive cases come out of that, and one of which was someone who had already tested positive, and they were curious as to whether they would test positive again or not, and 2 others were actually out of county. So it didn't bear a lot of fruit for us, which is why we've held off on having another community event like that. But given the circumstances that we're seeing currently, we're now starting to see some of the merit in offering some of that no cost, no symptom or symptom, but no symptom testing. Unfortunately, we can't run those events that's not a long-term solution. Certainly, the governor is willing to allocate resources to us, but it is not a long-term solution. So internally, we're trying to evaluate how we can get some of that no-cost or at least low-cost testing to folks in the community. Another thing we need to sort of keep our eye on is you all are aware of the public health alert system, which is the way in which the state is trying to use as a warning system, if you will, for communities that might be seeing an increase in disease. Fortunately, Athens has maintained orange for some time now, which is the sort of the second to the bottom of the list. It's yellow, orange, red, and then purple. We've not seen any counties in the state transition to purple yet. I do think this Thursday there will be some counties in the state that will transition to purple, and we're all sort of sitting back and watching to see what, if any, repercussions are the result of that from the state level. The information that we're getting is that the governor at this point does not have a lot of appetite to introduce any additional restrictions. So it could be left to the local levels to make some decisions as to if there are going to be any mandates or order tied back to the transition into purple. Hopefully, Athens County stays out of that. As we see spread into our elderly population and some of our long-term care facilities, that is going to certainly check mark probably 6 and 7 of the 7 metrics. Those metrics are tied back to hospitalizations and ICU capacity. And of course, we all know that the local hospital, while it's a great service to the community, it really is not. It's not built to manage large scale, respiratory distress type illness. So it wouldn't take very long for them to be full or operating at full capacity. So we're really watching closely what's going on at the hospital. We at the health department here talk to Ohio Health on a very routine basis. Sydney Weber and I are on the phone almost every day at some point chatting about what's happening. And definitely what we've heard from them in the past couple of weeks is that they're starting to see an increase in the amount of folks that they're seeing in the emergency room, and then as well as the number of folks that are being admitted. And then sort of the last thing that I can throw into the mix is that I did today get an email from the Ohio Department of Health indicating that the viral load in our wastewater coming out of the wastewater management plant has seen a 10-fold increase over the last couple of weeks. So I believe, and the mayor can correct me if I'm wrong, but I believe that the Athens City Municipal Waste Water Treatment Plant is the only plant that's participating in the county. But basically what that program looks like is that they do some sampling at that plant. The viral load is present in the wastewater, and they can do some calculations and some routine sampling and establish a baseline, and then based on that baseline can give you an indicator as to what might be happening in your community with just in terms of the virus. So I got that email today. It really doesn't mean anything other than they're just sort of putting us on notice that hey, we saw this increase and you all should be paying attention. And quite frankly, I think we've been on notice, for a couple of months now. So I'm happy to field questions at the end. I know there are a couple other guests that need to speak, but I'm also, if it's appropriate, can take questions now.
Let's wait till we have everybody present. And Dr. Ice, would you care to go next?
Sure. Hopefully everyone has access to the public dashboard that we put out so you have a sense of where the cases are. But just as a summary, as you probably noticed, we did have an increase in cases, pretty dramatic increase that started slowly about 2 weeks after phase 2 started and really peaked basically last week. And since then, we've seen a decline in cases among students. And at the same time, we've increased our testing for both the on and off campus students. Our positivity rates were very high early on. They're down to 6.3, which is still higher than I would like to have that. We're increasing our testing capacity every day. And so one of the things that you also probably heard about is the movement of students into quarantine in whole dorms. And the reason why we did this is because we were monitoring by residence hall the cases as they were increasing. And as soon as we see a positive case, we bring more students from that hall into testing. And between symptomatic and asymptomatic testing, we saw a big increase to the point that we had too high of a percentage. It would have, that same thing that Jack was just talking about is congregate living and the rapid spread. And so we did end up putting those, the health department put those halls into quarantine. And since then, we have actually are seeing quite a significant drop off in rates while still increasing testing. So I'm fairly confident that we're on a downswing and we're going to stay there. Hopefully it stays there. But just to let you know, and we are also doing testing of the off-campus students. And what I'm finding from looking at the cases as they come in, and as well as discussions with the health department, is that while there certainly are the sort of usual suspect neighborhoods where we are known for having large gatherings and so forth, really the predominant spread is these small gatherings of like 2 and 3 people that let their guard down, and each person has 2 or 3 people. And I think that is what's happening not only on campus with our students, but it's just happening in the state and nationally. And so that's a continual effort on our part to try to redirect students, provide alternate activities, and try to really educate them about reducing their risk and the risk to community. We are also, we talk very regularly to the other IUC or the state schools to get ideas from them, things that went well, things that didn't go well. We're in the process of adopting a alert system that Miami uses that's sort of modeled a bit after the state warning system. And so some of the residence halls that had creeping up rates, we've already sent them warnings saying you're getting high, please redouble your efforts to be careful. And thankfully those rates have come down. So I think we've learned a lot about how to manage this better, and moving forward, we have a number of changes that we will make, including making weekly testing for on-campus students. And our goal for next semester would be bi-weekly testing for off-campus students. And in our discussions with other schools, that has been a critical component. Jack's on the phone a lot because I also collaborate with him quite a lot, and we talk multiple times a day, and always looking for ways that we can also better coordinate and collaborate. And I think we're moving in the right direction there as well. And those are the highlights, and happy to answer questions.
Okay, thank you. If we could go on with Chief Pyle.
Thank you, ma'am. I'll just speak specifically from the enforcement side of things with the police department. Let everyone know that we don't get a lot of complaints either for mask ordinance violations or mass gatherings, though we do proactively police for the latter. And we do what we can with crowds when we do see them uptown as far as mask enforcement, social distancing. That's always been a challenge. I'm interested with what Dr. Ice just spoke. I've not heard that the transmission is predominantly from smaller groups, and that's interesting in regard to enforcement of mass gatherings. I would tell you that observationally, the officers in my department believe that the students are rising to the challenge and haven't been violating mass gatherings on the weekends to the extent that some people seem to believe that it's happening. And I would also say that social media isn't very helpful for these things. A lot of times people get fired up from social media posts and pictures that are posted on social media that turn out to be, weeks old or several days old. And they refer to those pictures as happening just last night or the night before. And it kind of gets people fired up, but it's not in reality what we have witnessed occurring, certainly in the last several weeks. So we have a big weekend coming up, possibly traditional Halloween weekend, and no real way of knowing what that's going to look like. But we will be prepared to respond to any type of issue this particular weekend. And we do have Beggars Night activity going on from 5:30 to 6:30. Is that right, Mayor?
That's correct.
Yeah. And I believe Honey for the Heart reverse parade earlier, maybe 4:30, although Terry probably could speak to that. I'm not exactly sure of the time. So we will be out in force and available this weekend if needed. So I'll just stop there and field questions.
Thanks. And Mayor?
To circle back around, the Honey for the Heart parade in place will be from 1 to 3 p.m. down at West State Street Park. The interesting thing about that, and I've shared this with council in the past, is that this is an event to where there will be the Honey for the Heart parade costumed individuals, puppets, whatever, kind of lighting the roadway as you come into West State Street Park, distance, of course. But it affords families to be able to drive through in the comfort of their own vehicles with their windows rolled up or whatever, to go down and experience the Honey for the Heart parade. I was asked earlier, why did we change directions when we said that the Honey for the Heart parade was not happening? Traditionally, the Honey for the Heart parade took place during the Halloween block party on Court Street. And as all of you are well aware, council never authorized for the closure of the street, nor for suspension of the noise ordinance. Those ordinances were not brought forward because we are living under a global pandemic. So that, again, that won't be happening. But for the Honey for the Heart to have a parade in place on the West State Street Park grounds makes sense to do something like that. And as Chief Pyle indicated, the neighborhood trick-or-treating is still 5:30 to 6:30 p.m. I had consulted with Mr. Pepper about this at the health department, and this being early on, what is the most appropriate thing before the ODH guidelines came out, and that's what they are, is guidelines. If you read them, which is posted on the city's website, it's pretty clear what those guidelines are, what's being recommended. It is a recommendation for neighborhood trick-or-treating. My question to Jack Pepper was, what would happen if the city were to transition to level 3 red or to level 4 purple? For level 3 red, again, within the ODH guidelines for neighborhood trick-or-treating, it doesn't really speak to levels and what should happen. It would be great if it had, but it does not. So we are strongly encouraging people on their own private properties, if this is what they choose to do, that they follow those guidelines very carefully in how you can deploy, for lack of a better term, candy to trick-or-treaters. Certainly families, if you're going to be out on the 31st between 5:30 and 6, that you go as a family unit, not with a bunch of other people. If you think about it, that grouping, the no greater than 10 individuals still holds here in the city of Athens. The police department has been very vigilant of patrolling around and looking to see if there are larger gatherings of people more than 10. And when they do see them, they address them. I'm often out on a Friday or a Saturday evening and looking myself, and I'm often calling in the non-emergency phone number for the Athens Police Department, which again for everyone is 740-592-3313, and reporting the address and what it is you're observing to where the police department can then respond to that gathering. The same holds true for face coverings. One of the things that I do want to share with council and to anyone who's tuning in tonight is, we have been watching the data coming in for a while now. Initially, that data was pretty low in terms of our numbers for about 6 months or 6 weeks or better. As a lot of you recall, the city was holding at 3 cases total, and then we started to see some creep. And then in July, late June, early July, we really started to see that first spike that you're all well aware of. And then rolling into August, we started to watch it go down again to where at one point in mid-August, we were down to 5 positive cases. And we were kind of almost holding at new cases, or at the total cases, again, a little bit of a creep. But then we started to experience this second rise, which was more linear. When you're looking at those numbers coming in, it wasn't as accelerated or exponential as we saw back in July, but all the same, it was certainly rising to where now we're seeing on recent weeks more positive cases per day, and that's the number I typically look at, is the positive cases, than we have seen, certainly than we have seen all along. One of the things, and by sharing those numbers in generalities to you, the thing that is really, really needed, I believe, as a PhD health psychologist with some training in epidemiology, is we certainly, I believe, need someone who is a trained epidemiologist, someone who understands biostatistics, and start to really look at all the different factors that we are posed with. Jack Pepper just mentioned a minute ago about the viral load or the antigens in coming through the wastewater treatment plant. In looking at those numbers, we really don't know, because it's a single source, as I understand it, single sampling source. We really don't know. It doesn't help us with identifying, at this point anyway, whether those are coming from specific areas in the city. What we do know is the data that reflects the new cases that are coming in, or what the positive cases are. So certainly, one like myself have been sitting there creating my own Excel spreadsheet and trying to look at patterns. I think we're better served by having someone who's trained in this area. This is what they do for a living, looking at these numbers and helping us all better understand what are the patterns, what are the areas that we should be really concerned with. So there is still some work, I believe, to be done. But I know that the university has been doing everything that it can on their end. The city, we've certainly been doing everything that we can. And in a lot of ways, we've been helping each other back and forth. As you recall, City Council, that we did, in prep, make sure that we were getting CARES Act money to the Athens City County Health Department for the deep freezers that would be needed once a vaccine becomes available. But make no bones about it, that vaccine's a ways out, and to not sit around thinking that it is coming anytime soon in quantity. And then also the $25,000 that we have put forward through HAPCAP for the mortgage/rent relief, as well as the $75,000 for the Athens City utility relief for individuals who are really struggling with covering their rent and mortgage here in the city of Athens. So we're certainly watching very closely with the weekend that we have ahead of us. We will, as in lots of conversations with Chief Pyle, with Captain Harvey, also with Ohio University, that we are prepared for this weekend. But again, we just don't know, and but we feel we're prepared.
Thank you. Okay, we'll open it up for questions amongst council members. If you have specific questions to address to anyone, Councilmember Smedley.
Thanks, President Isley. First off, I want to thank everybody, all of our special guests here tonight, for providing that comprehensive overview. I just thought it's just extremely beneficial for us as council and for the general public to hear from all of you and appreciate everything that you've provided tonight. I have a few different questions, and I'll start with one, and then you can come back to me if no one else has any other questions. This first one might be for Mr. Pepper. Do we have any areas that would be considered hotspots right now? And if so, would you have any recommendations for how to control the spread in hotspots?
Sure. So just in general, to talk about hotspots and controlling hotspots, the reality is that the messaging that you've been hearing for months now is really the messaging that needs to continue to control hotspots. What we're really seeing is that people are suffering from COVID fatigue. Folks are not used to having restrictions. If they've not been personally affected by the disease in some way, shape, or form, a family member, a friend who's gotten the disease and struggled, it's very easy to become complacent. So I think that the messaging is twofold. One is continue to practice all of those public health measures that you've been hearing. So the masking up, the 6 feet, social distancing, carefully choosing and evaluate how and where you go. Understand that there is risk, no matter where you go, including, maybe your neighbor's house for dinner. And then the second thing is that I think that from a messaging perspective, we need to start reminding people that you cannot become complacent. It is a very contagious disease. I understand better than most how tiring, the past 8 or 10 months have been. And what we prepared for in April and May, when we had the very restrictive orders from the governor in place, is really what we're seeing now. And so now is not the time to become complacent. Now is the time to become vigilant and practice all of those public health messages that you've been hearing for so long.
Okay. And thank you. I think we had a question from Councilmember Clodfelter.
Yes, thank you, President Isley. I actually have one for Dr. Ice as well, but if you don't mind, I'll start with Jack Pepper also. I just wondered if you'd be willing to share, in case members of the public are listening, what the current capacity is of Oblinus Hospital to take care of intensive care patients, and also the number of ventilators that are in that hospital.
Sure. So unfortunately, I am not the best person to ask, but I am certainly happy to get that information to you tomorrow. And I don't want to misspeak on behalf of the hospital. But what I can tell you is that generally speaking, the hospital is not built to manage a large load of high need patients. So, given a typical a typical month or 6 month time period, or them basing what they have available based on long-term trends. You add in a pandemic or a disease like COVID, And it doesn't take long for the hospital to exceed its capacity, because in addition to what you're adding in terms of COVID cases, you also have to remember that heart attacks haven't stopped, strokes haven't stopped, God forbid accidents, and so that's how they typically build their modeling for what they need. And quite frankly, we're very fortunate to have any hospital services here in Athens County, but bear in mind, it is a rural hospital. So, I would venture a guess. I don't even want to speculate because I just don't know the answer, but I am sure they have less than 10 ventilators at Oblenis currently. And I think the number is closer to 7.
Can I tack something onto that? Just general knowledge from over the summer when Colonel Stone was working with military on setting up emergent hospitals in the area. I can tell you that the plan then was that small rural hospitals like Oblenis and others in Ohio would be the hospitals to receive non-COVID critical patients, things that they were able to care for, heart issues and things like that, and that the majority of critical COVID cases would be sent to Columbus, Cincinnati, and Cleveland, and where they had critical care facilities that were set up more along those lines. So I'm not aware that anything like that's anything about that plan has changed, other than the need for it seemed to subside over the summer. So, but that was the plan. So I would suspect that's the same.
Thanks. That's helpful information. Other questions before we circle back? Yes, Councilmember Grace.
Thank you. Mr. Pepper, I was just wondering, you mentioned that the health department is planning to accept the offer from ODH for a pop-up testing. And I believe I understood that correctly. Do you have an estimated date or time frame when that might be happening?
It will definitely be within the next few weeks. So it'll be sooner than later. A lot of that depends on, we have to give, it'll be run by the National Guard. So it'll be very similar to the testing clinics that we saw earlier in the fall. There are some scheduled events already that are not in Athens County or in Southeast Ohio. So when we jump into the pool, so to speak, they've got to there's a little bit of lead time, but they've been clamoring for a couple of weeks now to get something here. And we really wanted to hold off until we felt like we could really benefit. And we're starting to get quite a few phone calls at the office. People asking about, hey, I'm concerned, where can I get tested, but I don't have any money. And so as we started to see this community spread, we got the information about the viral load at the wastewater treatment plant today, and you start to add in that we're getting some phone calls about, hey, I'd love to get tested, but I can't afford the $95 at a pharmacy, or I'm uninsured and I'm very fixed income. We decided that it had merit and we would move forward at this point. So I would say in fairly short order. I don't want to say, in a week, because I think that's probably unreasonable, but certainly in the coming weeks.
Thank you.
And quick follow-up, do you know where?
Now that's still up for debate. We did have the two events at the high school in the Plains. It was built very well for that event. We certainly, are not opposed to moving. We ran flu clinics. We've had 2 flu clinics now, drive-through flu clinics here in the last couple of weeks. So we're very familiar with the fairgrounds. The Fair Board has been really amenable to any of our requests. So if we wanted to centrally get it more into the middle of the county and even into Athens, that certainly is not off the table. And our partners at OU have been outstanding to work with thus far. And I'm pretty confident that if we needed to, if the fairgrounds venue wouldn't work and we wanted to be even more centrally located on campus, that we could make something work there as well. So I think that's up for negotiation at this point.
Okay, other questions? Councilmember Reisner, and then Councilmember Fall, then Councilmember Crowell.
Thank you, Madam President. This is to anybody who can answer it. Today's being Monday, I believe it was on Friday, I went to a local fast food place on Richland Avenue. I'm not going to name any names. Get a coffee, and while driving through to pay my money, the lady who took my money had no mask. And I looked through the window and I could see someone behind her with a mask down past her face or over on her chin. And then when I went to actually pick up my order, another person who was pouring drinks or something like that had a mask below the nose. And I thought, wow. I made the mistake of going back again in the afternoon for some reason. And even though the people had changed, the situation was still the same. I still saw people there either improperly wearing a mask or not wearing a mask at all. Now, maybe they have a good excuse not to wear a mask. Perhaps it's medical, which to me would say, well, if a person who serves or works in a restaurant has, for some reason, the inability to wear a mask, that person should not be working. As hard-hearted as that sounds, that's a feeling that I have. It seems like it would be appropriate. Or perhaps it's just a lack of good management there on that day. Things just simply weren't being enforced. But I certainly do know the city did pass an ordinance, though not specifically towards food handlers, but did say you should wear a mask in those situations. And I'd like to know if that was just a sample of two at one site. Is this occurring other places? And how is it policed? How is it enforced? At what responsibility do the managers and owners of a restaurant have towards enforcing these things? Do they have any responsibility at all? That's an open-ended question. I realize that. But
Thanks for the question. Yes. And Mr. Pepper, do you want to respond? Is there a form, I believe, on the City County Health site?
There is. There's a complaint form. We do follow up on complaints. I'm not going to tell you something fictitious that it's a perfect science, because it's not. But we do follow up on all of our complaints. I will say that we are struggling mightily in the food service industry and in convenience stores in gaining masking compliance with employees. They are obligated, the managers are obligated / ownership in ensuring that their staff are properly wearing facial coverings unless they have an ADA medical exemption.
Okay.
Let me just say, I tried to find that form to file a complaint, but I found the site a little confusing. I wasn't quite sure what the forms to complain really were. One was so badly worded it made it sound like I wanted to complain about wearing a mask as opposed to complaining about someone not wearing a mask.
Well, I certainly am happy to look at, evaluate, what forms are there and how easily accessible they are. We want to make that website as user friendly as we possibly can. So your feedback is always appreciated, and I'll take a look at it tomorrow.
Okay.
Great.
Councilmember Crowell.
Thank you, President Isley. Thank you, Dr. Rice and Mr. Pepper for being here today. I really just have a public service announcement, and Mr. Pepper took the words out of my mouth, and that is simply that given that our hospital is somewhat limited to deal with COVID patients, and any kind of increase in the number of patients that they have is a burden on all of us. Get your flu shot. That's my PSA. The health department set up a fantastic drive-through opportunity right next door in the fairgrounds, as Mr. Pepper said. I think it took my entire family less than 5 minutes to drive through there and get that done, and it was great. So that's my PSA: is get your flu shot. Thank you.
Councilmember Fall.
Thank you. I've had several people complained to me, worried about Halloween because the Near East neighborhood is somewhat of a light to moths. And so I want to just make sure that people understand that nobody is required to partake of the Halloween. If people are in the neighborhood, if you just don't want to deal with it and stuff, that's your perfect right to not deal with it. And so turn off your light, your porch light, if you want to, do other things, watch a movie or something, but there's no requirement. And so people were a little confused. So thank you.
Thanks. Councilmember Katsas.
President Nisley, thank you. And Dr. Ice and Jack Pepper, thank you for attending tonight, along with Mayor Patterson for providing the update. As I've been listening to the conversation, and I was thinking back to the ordinance that we passed back in July, I have had conversations since then that the ordinance itself maybe could be worded a little bit stronger. And so I'm not asking to do anything. I talk about that this evening if nobody wants to do that. I'm only one of 7 of this group, but I do want to just offer that conversation can always continue if there are additional tools that are necessary as the situation evolves and we learn more.
Thanks, Councilmember Katsas. I know that Councilmembers Smedley and Clodfelter had 2 additional questions. We're at 7:42 right now. If we can try and wrap this up around 7:45, that would be great. So, Councilmember Smedley.
Thank you, President Isley. I had several other questions. I could maybe do those by email, but I'll select just a few of them. Just one more. First, a quick comment. As Mr. Pepper mentioned in his update, we are seeing community spread now, and we know how quickly things change with COVID-19. And we've experienced that since the very beginning. And of course, and now that we're seeing it in a long-term care facility, it's very concerning. And so we will all do our part, I'm sure, to remind our community members of the ordinance that was passed and all the social distancing guidelines that are in effect, so that we can do what we can to stem the spread. Director Pyle, I appreciate your update as well. There was, I wanted to ask if this past weekend, or the weekend before that, I guess, where we had this sort of unofficial homecoming event in town, if there were any lessons learned from that, or any experiences that you had that were challenging that would inform how we could best mitigate any issues leading up to Halloween. Is there anything there that would be helpful to you? Can council do anything to support what you're doing, or that you would need to do leading up to Halloween?
I think the mayor, when he spoke to the bar owners group, resolved the single issue that we had, requesting that they be more communicative with us in the future when they plan to have openings at 6 a.m. like they had, things like that. So I think that was the one thing that could have prevented what had happened. Perhaps maybe not prevent, but we certainly could have been more prepared for what happened Saturday morning with the crowds in front of the bars. Beyond that, it wasn't a horrible weekend. Just that large group during the day or during the morning was a bit of a surprise for us. I bet the mayor can add to that.
Yes, Mayor Patterson.
Happily, Chief Pyle. The chief is correct that we did have a meeting later that week, the following week, with the bar owners. I've been meeting with the bar owners for several months now, and what was a little disheartening, and I shared that with the group, was since we were working what I believe to be together and understanding with the reopening process, everything that was being done to help mitigate any level of spread. That all said, with the meetings that were had, we were, in terms of detail, completely unaware that there would be places, drinking establishments open as early as 6 a.m., completely not on the radar. Had it been, we certainly would have been more, we would have been staffed up more effectively to help with spreading the individuals out and to mitigate that. But I did have a lengthy conversation along with Chief Pyle with the bar owners following that. So hopefully we have a path forward, because I was also concerned about what may be happening this coming weekend. And I was advised by all of them, not advised, I was being informed by all of them that something like that was not part of what was being thought through going into October 31st.
All right, thank you.
Thank you.
Councilmember Clodfelter.
Thank you. I'll try to be brief. My question is for Dr. Ice. First, I wanted to applaud Ohio University for trying to get so many students tested and for planning to test them weekly for those who live in the dorms and then bi-weekly for the students who live off campus. And I'm just curious, that sounds like a pretty massive amount of tests. So where are you getting the testing evaluated? Where are they going to the labs? Are you doing that in-house somewhere in the biology department? And how quickly do the students get their results?
So right now we are partnering with, of course, Ohio Health to do all of our symptomatic testing. We're discussing expanding that to asymptomatic contacts as well. That's still under discussion, not finalized. But our asymptomatic testing surveillance program, or wide net testing, as you might have heard me talk about, is run by CVS. They're partnering, they are on campus to do that test. And they're using a test called an Abbott ID now, which is a viral test, but it's a rapid one. So it's a 15-minute result, and the student or employee gets the test result in real time. We've slowly been ramping that up to make it possible to test everyone in housing before the end of the semester. So we've added hours at the end of each day. We're adding weekends coming soon. We're adding machines to ramp up the capacity. But moving forward for spring, where we really want to test much more aggressively, that in our discussions with other state schools, that's been critical to keeping the numbers down. So that's our goal. And we're talking to a number of vendors because each test has different probability, sensitivities and specificities. So different false positives, false negatives. So you have to balance that with respect to turnaround times and who can deliver it for us, because we do not currently have a lab that's capable of doing that. The state is entering into some partnerships that we might be able to utilize. So basically, we're talking to about 5 different people or companies and trying to decide what the best fit is for us to be most efficient, most tolerable by students. If you're going to be tested weekly, they don't really want to have a very long, the typical PCR test. So everything's under consideration at the moment, and we hope we finalize hopefully within a month or so.
And Dr. Ice, you had a question from one of the public attendees, and they said, will these tests be mandatory?
Yes, they will be, and they are mandatory. Students in housing are required to participate in the tests. We also require off-campus. It's a little bit more tricky in terms of consequences with off-campus students. But yes, they are mandatory, and they will be mandatory going forward.
Okay, great. Okay. All right. Well, thank you all. Thank you, Dr. Ice and Chief Pyle and Mr. Pepper and the mayor for responding to our questions and providing an overview. I think this is really helpful. And there are reporting numbers, as the mayor mentioned, the city police dispatcher number, the 592-3313. The Ohio University has a dispatching number, the 740-593-1911. And the City County Health Department does have that form that Jack will be looking at tomorrow. I know he's very diligent about things. So we appreciate your time and thank you so much for joining us tonight. Okay.
Thank you all.
We'll move on to
Yes.
an Arts West update, and we have Director of Arts, Parks, and Recreation, Terry Moore, has joined us and has been waiting through our discussion. So welcome, Director Moore, and we'll turn the floor over to you for a presentation.
Thank you, President Nisley, and honorable council members for giving me the opportunity to provide an update on the status of Arts West, as well as my plan to return program specialist Emily Beveridge to work. It's my recommendation to the mayor and safety services director, Tom Pyle, that Emily return to work on November 2nd in full-time status. It's expected that the employee work in full-time status in arts programming area, as well as support the department overall as needed. As you know, there was a temporary layoff August 7th due to lack of work. The employee was placed on 2 weeks paid leave. Lack of work was a result of canceled rentals, programs, and services due to the COVID-19 pandemic. The governor issued mandatory closures and cancellations, closing Arts West. As far as other facilities, all of the facilities were closed on March 16th. Reopening facilities and providing services were, that was initiated in the order of Restart Ohio. Opening gym and fitness centers was one of the first orders initiated by the governor. We opened the Athens Community Center accordingly on June 15th under the gym and fitness center requirements and recommendations. On July 30th, we contacted the health department with regard to opening programs at Arts West, PRISM, and other programs, and we were it was recommended that we can follow the school board guidelines and offer those programs virtually if at all possible. The Performing Arts Restart order was not offered until late August, and at that time it was my intention to continue to try to offer the programs that we could at Arts West. Those programs included Silver Linings, Spoken and Heard, and we have managed to offer Spoken and Heard, the poet storyteller events, and we've added a date through December. Under the Performing Arts Restart requirements and recommendations that was announced on the 24th, the requirements included a capacity reduction to 15%. Capacity at Arts West is 273. 15% reduction would reduce participants to 41. Other requirements are still the 6-foot distancing in all areas of the facilities, and group activities are restricted to 10 and under. So how we offer services and programming has changed. The mayor has taken the lead and been on the forefront as far as providing support and as far as future programming, virtual programming, kind of setting the tone for that. Committing CARES Act funding to upgrade connectivity at Arts West. That is by adding fiber, we will be able to offer the virtual programming. The project is under the lead of David Dudding, the IT director, with the support of interim director Jessica Adine. An updated that was provided today is that the contractor Zayo will likely be laying the conduit needed for Arts West in 2 weeks. Director Dudding has received a quote for all other work, and he does not think the project will be completed by December. And I'll defer to the mayor for a few more details on that. But as I understand, everything's in place and we're on go with that project, which will be critical to how we offer services at Arts West moving forward.
Thank you, Director Moore. And Mayor Patterson, did you want to add anything at this point or open it up for discussion?
Certainly. So we were fortuitous. One of the things that we're finding under the current pandemic in every other municipality across the nation, trying to act quickly to enhance their own connectivity with city, village fiber, is that fiber is becoming more and more difficult to identify. We were able to utilize some funding that was already appropriated to purchase fiber for the city, not using CARES Act money, but money that didn't have a particular project associated with it. So at this point, with Zayo laying conduit and with us already owning a significant amount of fiber, it's 144 strand, which is significant fiber, that we feel that with the budget that we'll be getting before council, that we can find a different pathway to still make sure that we have solid, reliable connectivity from the city building to Arts West moving forward. So that is going to happen regardless of the December 31st timeline that has been imposed with the CARES Act funding. We think that there's a different way that we can move forward with this, and council will be hearing more about that in the near future. But we really feel that I feel strongly that for that particular facility, having the ability to program virtual content on a reliable basis is what's going to make it successful moving forward, because as we're all hopefully well aware after the previous conversation, COVID-19 is not ending anytime soon. We'll be having to continue to do a lot of programming virtually for many, many months to come. But I've been working very closely with Terry Moore, who's done an outstanding job in trying to figure out something under extremely difficult and challenging times, as you're all well aware. And I really appreciate, Terry, that you did bring up the timelines in terms of the community center reopening, because it wasn't as if the governor's order to reopen came out and the next day it reopened. It still takes Director Moore a lot of time to sit and figure out how do you do this safely as we move forward. The other thing to share with council and the viewing audience associated with not just Arts West, but with all the city buildings, is that we did use CARES Act money to purchase the depolarizing ionizers at the community center, which is a system that draws down all kinds of particulates to include COVID-19 particulates and gets them out of the circulating air. We also put those at Arts West, the city building, the law director, or the police department / law director / auditor's building. So we've done a lot in that realm as well, because that was the other thing. Even though you can only have 15% in Arts West, to know that we're doing everything that we need to do to make sure that the air circulating through that facility, as well as the Athens City Community Center, is, we're doing what we need to do to make sure that we're making as safe as an environment as possible.
Okay. Do we have questions from council members? Councilmember Crowell.
Thank you for being here tonight, Director Moore. Appreciate getting this update. I'm curious as to how things are going at the community center. If you see that attendees are following the policies that you've set in place, and if they are under the same 15%, are you under the same 15% capacity at the community center? Thank you.
So, as far as capacity, we are not. There is not a capacity. There was not a capacity for gym and fitness center openings. The distance requirement is there, and it's mandated that, well, as in all city buildings, that masks are worn to the extent possible when working out, but definitely when they enter the building or if participants are idle. We've kind of had a couple hiccups with having to remind patrons to wear masks, but for the most part, that it's been pretty smooth. I had hoped, I did have the numbers. We're averaging, let's see if I have it here. Maybe I don't. I thought I had the numbers for participation. Our highest numbers are on Monday, and that's in the 140 range. Our low numbers are on Saturdays, which is roughly 40 people. And then through the week, it just varies. We have had a membership campaign this month, so we do have folks buying memberships, and yeah, so for the most part, it's going well. We're anxious to do the next piece. We have the courts reserved in the gymnasium for basketball as well as pickleball. Again, that's changed, and we're monitoring that. Again, I have been in constant conversation and contact with Jack Pepper as we open a program or the next phase. I'm looking at how we can potentially offer youth programs. We currently have outdoor programs, but as the winter months approach, trying to determine what we can offer in the facility itself for youth activities. So that's going to be the next conversation with the health department. Is it feasible? Can we do it safely? And with that in mind, can we offer something that is at a minimum revenue neutral, or a program that we can capture revenue on? Because I think that's critical as we look at the remainder of the year, as well as moving into 2021, how creative we can get and what we can do to capture some revenue both here and at Arts West.
Just real quick follow-up. How do those participation numbers compare to pre-pandemic? On a Monday, you said 140. What are you getting on a Monday in 2019?
We're about a third. We're at about a third capacity.
Thank you.
Yeah.
Oh, okay. Councilmember Smedley.
Thank you, President Isaiah, and thank you, Director Moore. Appreciate your being here tonight and the challenge you've had before you since March. And I know there was a great response specifically to Arts West. And so it's great to see we were able to come up with a plan to see it reopen safely. And, I know the financial piece is still a concern, as you just mentioned, and certainly hopeful that some of the virtual programming that we'll be able to provide could generate some revenue. I know there was some discussion too of creating a Friends of Arts West, and wondered if you had any updates on the status of that, and whether or not that was still something that was a possibility. Thank you.
So, yes, it's still a possibility. I've had conversation around, initially advisory board members. There were 2 advisory board members that were interested in creating a Friends of Arts, Parks, and Recreation. And then when we realized with the Arts Midwest grant that we couldn't apply for that it might make sense to have a Friends of Arts. Yes, that's a possibility. My thought now is that if we go with a Friends of Arts, then I was concerned about having a number of friends groups for the department. But I think that we may have to go with 3 different groups. Maybe it's parks, maybe it's recreation, and then there's an Friends of Arts. So I am thinking through that. The last advisory board, that wasn't on the agenda, and it didn't come up. Again, I have 2 advisory board members that were active in taking an initial stab at that, and that was Brandon Thompson and Shauna Schweitzer. But the thought is to revisit that. I know the Forest Neighborhood Association wants to consider having a Friends of Sells Parks. So maybe that's where the parks piece comes in, but absolutely, yes.
Thank you. I appreciate that. Just a quick follow-up comment. I think you'll find, although it might be a management challenge, I think you'll find people who are very much in support of the arts, very much in support of the parks, or very much in support of the athletic piece. And so it might be beneficial to have 3. I know that might be a challenge to manage, but that's just my 2 cents. Anyway, I appreciate your hard work and looking forward to seeing what comes.
Thank you.
Other questions or comments?
I do want to point out that, in the last 3 years with Arts West, there's been a commitment, a funding commitment there. The renovation, which took place in 2017, 2018, that project was $190,000. We built the exterior accessibility ramp on the back of the building. That was a 2018 project. And in 2018, upgraded audio equipment and computers at Arts West. And then most recently in 2019, new carpet, tile, paint, refinishing the stairs, and the stage accessibility ramp. We're putting a permanent ramp, stage accessibility ramp. The permanent ramp should go in November. So I think we've put some things in place that are positioning us for more good things there.
Okay. All right. If there aren't any other questions or comments, we thank you, Director Moore, for taking the time tonight to give us this update. It's very helpful.
Thank you, President Nicely and council members.
Okay. All right.
Thank you.
Our next agenda item is an Energy Innovation and Carbon Dividend Act. And this is a request that the mayor initially received from the Ohio State Coordinator of the Great Lakes Regional Citizens Climate Lobby, and refers to a piece of federal legislation that began moving through the U.S. House of Representatives in January 2019. That particular legislation would establish a fee on fossil fuels at the point of entry into the economy, with the effort to reduce carbon emissions. And since that legislation is due to expire at the end of the year, there is increased interest in having local municipalities join in and support this resolution. And so what we've been asked to consider is requesting a resolution to endorse this Bill 763. And I know that I believe Council Members Fall and Crowell have taken a look at this. And I know Mayor Patterson has been in conversation with Mr. Saban. And so we have a draft of a resolution, and that points to the many ways in which Athens City has been involved in energy kinds of solutions or programs starting back in 2007, and the different measures that the City Council has backed at the city level, such as the Green Fleets policy, our solar energy system, our solar powered recycling, our climate action plan, our electric carbon fee, Councilmember Small's recent work on the solar energy systems, changing our Athens City zoning code. So all of these pointing to it being what would seem to be a reasonable request of the city to endorse this particular piece of legislation with a resolution. So I'll open it up for any comments. It looks like Councilmember Crowell, yes?
Thank you, President Isley. Yes, I would just like to, when the mayor and President Isley shared this potential resolution with me, I looked into the Energy Innovation and Carbon Dividend Act and shared the information I found with the Environment and Sustainability Commission. And there are a number of people on the commission who have worked closely with related issues in the past, including our own local Athens carbon fee. And the commission is very supportive of this resolution and supporting this act. I'll just say that it really does sort of hit the triple bottom line of sustainability. It really benefits the people in that families actually get paid. This is a dividend, a monthly dividend that comes back to Americans. It's worked out to support jobs and clean energy. So it's not just trying to do away with fossil fuels, but supporting the clean energy economy. So it really is supporting the economy. And of course, both in terms of carbon emissions, carbon pollution, it supports the environment. So I'm fully behind this, and I commend the administration for bringing it to council's attention.
Councilmember Fall?
Thank you. And I want to say thank you too, especially to the mayor for bringing this forward to our attention. This fits right in with our climate emergency resolution that we passed at the beginning of the year. So this fits right in with all the other things that we've been doing to move us forward, going towards net neutral. I would like to point out a couple things that this sort of forward-thinking legislation makes sense, and it makes sense because when you look at Texas, when you think about Texas, you think of oil. Well, right now in the state of Texas, more people are employed in the wind energy production sector than in the oil and gas sector in Texas. So when we start talking about climate change that was talked about at the last debate, and going and transitioning towards a cleaner, carbon-free fuel sources and energy sources and electricity sources, that I don't think is going to be quite as scary because we've had forward-thinking people doing these sort of things every day. So I think that it's a really great option to really get us pushing towards that zero carbon. So thank you.
Yes, Councilmember Clodfelter?
This sounds really encouraging. And I just wonder, for the benefit of the public, if one of you would be willing to just sort of simply explain what this would mean for the average family in Athens. How would these dividends be determined? How would this affect their bills? Anything like that?
I don't know that I have that specific information, but Councilmember Crowell, yes, you can help us.
Member Clodfelter, that's a wonderful question. I don't have the specific answer as to, individual income level, et cetera. I can share with you what I do know, and that this does put a fee on fossil fuels, on coal, oil, and gas. And now the idea is that this will obviously drive down pollution, drive down greenhouse gas emissions, which will lead industry to move towards cleaner and cheaper options for energy production. The money that is collected from the fee goes back to the American people every month. The government doesn't keep any of the money. Some of the fee goes to administrative costs, but that doesn't go into any bank account that the government has. It goes back to the people. They also have a border carbon adjustment so that really to protect U.S. manufacturers and jobs, that imported goods will pay a carbon fee at the adjustment at the border. And goods that are exported from the U.S. will receive a refund. They estimate that in year 10, so this is an escalating sort of policy, it grows over time, that in year 10, the average family of 4 would receive $4,410 in the 10th year, or maybe it's the 11th year. So it is estimated that 80% of middle and low income households will either get a boost or essentially break even. So it's all up to individual families how they spend that money. Again, they estimate that 2.1 million jobs will be created over 10 years. Which will also obviously help people. And there's lots of other speculations that they make, but I'm sorry I don't have more specific information for you, but that's what I do know.
That was helpful. Thank you, Member Crowell.
Other comments or questions? Mayor Patterson, did you want to make a comment about this?
Certainly. I just strongly encourage council to bring this resolution forward. I will disclose to council that in my conversations with John Sabin, and John is the Ohio State co-coordinator as well as the Great Lakes Regional co-coordinator. He's the individual who brought this to my attention after I had presented the Athens City carbon fee on several different climate action webinars, but he's with the Citizens Climate Lobby. There is the option for quote unquote prominent individuals to endorse, where you would go, if you go to their website, in excess of 500 mayors, city managers, elected individuals have already endorsed this. I have already endorsed it. So again, I'm really encouraging City Council to bring this resolution forward because it falls directly in line with our carbon fee here in the city of Athens.
Okay, thank you. All right. Seeing no other comments, I will open it up for the Finance and Personnel Committee, and this is chaired by Councilmember Crowell and joined by Council Members Reisner, Kotsis, and Smedley.
Thank you, President Isley. The first item we have on our agenda tonight is a staffing item. As everyone is aware, we had a change in the EPW department, and the assistant city engineer, Jessica Adine, has stepped into the director's position. So with the support of the city administration, I'm giving council the information that we would like to give a pay increase to Assistant City Engineer Jessica Adine, who is now the interim city engineer. We would like to upgrade her pay to $36.91 per hour. This would sunset at the hiring of a director for the department, or through the next calendar year. So it will end in December 31st, 2021, or when we have hired a new director for EPW. I will let everyone know that the money that is budgeted for that position is at a higher rate than what we are proposing that Ms. Adine be raised to. So it's not a budgetary problem The money is already budgeted. It would just be paying the interim director for the job that she is doing, and she's doing it very well. Mayor Patterson, would you like to comment?
Well, Sam, you said it very well. To me, it's simple math. It's equal pay for the equal job. You know, Jessica Dine is doing an amazing job with the number of projects that are going on in the city of Athens right now, and to pick this up midstream and keep things moving forward, she needs to be paid appropriately, period.
If I could just add one comment, if we could, I'm not sure the ordinance reads that, but if we could make that pay increase retroactive to September 29th, September 29th was the day that she started functioning in that position. That would be very helpful.
I think that's
Also,
fair, Chief. Sorry, Mayor Patterson.
If I cut out, I apologize. My connection is not all that stable right now, but hopefully what I said rang through to everyone on council tonight.
I think we heard everything you said. Okay, committee members. Member Smedley, did you want to mention?
Thanks, Member Crowell. Yeah, I just wanted to appreciate Jessica Dine and her stepping up in this time, and would agree, you know, you assume additional responsibilities, you would expect additional compensation for those additional responsibilities. And my interactions with her have always been professional, positive, and just glad to have her on the team. Thank you.
Thank you. Member Reisner?
Well, I agree with everything I've heard. I think she has been doing a great job. Short notice to come in on it. And if you're going to do the job, you should get paid for it. So I agree with the Service Safety Director, make it retroactive.
Agree as well. Member Kotsis, your last one left. Any comments tonight?
I support this, and that's all I need to say. Thank you.
Okay, great. Any other comments from the administration? Other council members? Yes, Member Clodfelder.
I guess I would just like to echo other people's thoughts, sort of. I think we as a community are really lucky to have Jessica Dine in that department. And I'm just delighted that a woman in the engineering field is going to be paid fairly. So thank you.
Okay, thank you. She certainly deserves it and is doing a great job, and I fully want to support her in that. Okay, no other questions. We'll move on to appropriations and transfers. We only have one item tonight in the realm of transfers. You may remember that the Athens County Municipal Court received a technology grant earlier this year. That money was put into the judge's computer fund, and the clerk of court of the Athens County Municipal Court has asked for a transfer from the judge's computer fund to the clerk's computer fund so they can pay for the case management system upgrades that they received the grant for. That's both hardware and software that helps the court to better implement their case flow and public access to their systems. So that's a simple transfer from the judge's computer fund to the clerk's computer fund, and the approximate amount provided to council was $23,000. Ms. Dye is going to get us the actual amounts soon. Are there any questions from Finance and Personnel? Yes, Member Reisner? Is that a right?
Yeah, that's my pencil. I just want to say I see that this is definitely necessary for the courts to, keep their systems up and running, and it needs to be done. I just want to know if I could just go off topic for one moment about the fiber optic that we are purchasing. Does that require any action from council to transfer funds, or will it all is that fund already set and able to pay for the fiber?
Member Reisner, if you're asking about the fiber discussion for laying new fiber going to Arts West,
Yes, yes.
that's a great question. I think the mayor has dropped off. It seems to me.
Yeah, it's fully
Yeah.
funded right now.
Director
The fiber-
Pyle?
Yeah, the fiber is purchased. We had existing money that we wrote purchase order on, and it is purchased along with correct sized vaults for the project, pole vaults that go into the ground. And I think they were delivered, or I think they're scheduled to be delivered this week. So no new appropriation is needed at this point.
Okay, could I ask how much the invoice is for?
The fiber is going to be $30,000 and the pole vaults are around $4,000 or $5,000.
Okay, thank you.
Mm-hmm.
I don't have any more questions.
Okay, anybody else on the Finance and Personnel Committee? And just catch the mayor back up. We're just talking about the money transfer and the clerk of court so that they can upgrade their, pay for their upgrades to the case management system. And Member Reisner asked about the if we needed an appropriation for the fiber going to Arts West. And Director Pyle answered that question. Okay, if there are no other questions or comments from the rest of council, that will end Finance and Personnel. Thank you, Madam President.
Great, thank you. We'll now move on to City and Safety Services, and that's chaired by Councilmember Grace and joined by Council Members Fall and Clodfelter.
Thank you, President Nisley. We just have one. And this is regarding the necessary replacement of the base radio system for APD. They are currently using a system that is from the early to mid 90s for the radio dispatch, and it is failing. And we have been informed that it is no longer repairable. The necessary parts and equipment are not available to repair a system that is this old and utilizes such outdated technology for dispatch. So we are going to be introducing an ordinance next week regarding this, and the estimate for the new base radio is between $112,000 and $120,000, and it's an entirely upgraded system as compared to the old technology, and we'll have some additional benefits moving forward in that if the city so chose in the future, it is an easily upgradable system because of the new technology, and would allow us to link into county 911 dispatch services and things like that should it ever become necessary. It's also a portable system that would allow, should it be needed, for dispatching to take place at an alternate location. And things like that are good to keep in mind in our current really unpredictable times. So again, it's 112 to 120, and the funds are available with the plan to use half of it coming from the overtime fund and half coming from the workers' comp fund. Those funds have enough money in them to cover the cost of this base radio system. Are there questions? Yes, Member Fall.
Thank you. I think that it should be recognized that once this is another like brick in the wall of resilience that we will have for the cities going through what we're going through now, and increases in any sort of storms or weather related occurrences in the future from climate change. And if, good communication channels are essential during especially during like a weather emergency. So this is a needed investment in the resilience that we have for the city. Thank you.
Absolutely. Thank you, Member Fall. Are there any other questions or comments from the committee? Yes, Member Clodfelter.
I would just like to thank whoever realized that this important, this important investment could be made from existing APD funds. I think that's great. So what a wonderful way for the department to invest in itself, so to speak.
Any comments or questions from administration, Chief Pyle or Mayor? Okay. If there are no other comments or questions, then that concludes the committee meeting for this evening.
Thank you, Councilmember Grace. We'll move on to Planning and Development Committee, and that's chaired by Councilmember Fall and joined by Councilmembers Reisner, Grace, and Smedley.
Great, thank you. We just have one agenda item. This is a special right-of-way permit for two informational signs, directional signs. This is on East Park Drive, which is the one that goes out to the dog park and the sewage treatment plant, and the other building, the Marietta Health what services or whatever they're called, want to put in a couple informational signs to go and direct people to the building that's out there. One will be along East State Street and East Drive. It will be a directional sign that will include the city park, the city pool, and the dog park as part of it. So that's part of the, they're working with the Arts, Parks, and Recreation people there to make it cohesive. And then there's a larger sign that's down where the road actually turns off to go to the building that's out there. So this will be for 7 years until it needs to be renewed. And it's been checked off by all department people in the city. Thank you. Questions? So, yep. Oh, Mr. Katsas?
Yes, and just a quick clarification, because I remember that Nicholas Bittner came and presented a while ago about a sign. Right. This is just going to be instead of. Yes. We're not going to see two signs there pop up at any.
Yeah. And the styling and everything is very similar. So they did a lot of the base work, I think, that the Marietta Health people came from. So other questions? Great. Thank you. I will bring that forward Monday.
Great.
My agenda is all gone now. Thank you.
Thank you. We'll move on to Transportation Committee, and that's chaired by Councilmember Katsas and joined by members Crowell and Clodfelter.
President Nisley, thank you. And I have three bullet points this evening. Two of them revolve around the upcoming holiday season. I know that we have a few holidays coming up before Christmas, but Christmas is coming. So we have our annual amendment to our 24-hour parking rule. So this will allow continuous parking for longer than a 24-hour period on city streets, and that will be from December 13th through January 2nd. So this is the same as we bring forward every year for when the students take leave. I know that this is a little bit different this year, but we still have to anticipate that we may still see some people try to take advantage of this program. So do we have any specific questions? It's pretty straightforward stuff. The second one is the Uptown holiday parking. And so this is the program that the city does to encourage more people to visit our Uptown businesses. This year, there is some, currently right now, we are looking at suspending the parking after 5:30 on Thursdays in the city parking garage. This is above the first level upper. And this would also then be on, this would be every Thursday in December and every Saturday starting on November 28th. The only caveat that we have is that a UBA, so usually the free parking on Thursday is in anticipation of the Athens Uptown Business Association's holiday programs, and they are having a meeting on Thursday to discuss this. So we're talking about it tonight, But when the legislation comes forward on Monday, that may be changed based on the decision that the Uptown merchants have come to towards the end of this week. There is a new component to this ordinance also, which is parking meters and suspending some of the pay times for those parking meters in the Uptown area. And this was specifically brought forward by the mayor. So I do know it's 5 o'clock in the evening, but I don't know if you want to add any additional points to this, Mayor Patterson.
No, Member Katsas, other than, to help facilitate the Uptown businesses that choose to be open. Hopefully, several of them will during the holiday season beyond 5 p.m. It certainly helps them in terms of having people come uptown and parking and doing some shopping, along with the parking garage that you just mentioned, with lifting on those said days. And this could also be something that we get a little bit further input from Ayuba at their meeting as to whether they feel this is necessary. I have heard from at least one Ayuba member, Uptown Business Association owner, saying that the 10-minute free parking, which those placards still exist on many of our parking meters uptown, that may suffice. So we'll get a little bit more intel on that from Ayuba as we roll this forward. But it's just ways in which we can certainly help our own small businesses in the Uptown area to where they are able to encourage people to come uptown, park free in front of their business and go in and shop. But again, more intel as we move forward.
Perfect. Thank you, Mayor. And do we have any questions or comment at this point? No. Okay. And so we need to discuss this now. We will be able to get all 3 reads in on these ordinances. The last one, and this is just a request to submit a grant application for issue 1 funds. And so let me pull up the draft legislation just so I get the agency right. So this is a state program. This is from the Ohio Public Works Commission, and it's a state capital improvement or local transportation improvement funds. And so this is a grant that we apply for on an annual basis. I was trying to remember what we did last year, and then I was reminded that we were successful in securing some money for Stimson Avenue. So I didn't even bring the ordinance forward, so that's probably why I couldn't remember. And so this one is they're looking at sidewalk and pedestrian improvements, specifically on the west side. Nothing has been, I don't think anything has been completely identified, but that is the project area that they are looking to apply for this channel of funding. I will also mention that the grant application is due on November 6th, so there will be a request of a suspension on first read come next Monday. So anybody in the Transportation Committee have any questions? Member Clodfelter.
Not a question, but I'm just delighted that the city has chosen to focus on improving the sidewalks and other infrastructure on the west side. I think that's a really great choice to make.
Yes, I agree. Do we have any other comment from council? Member Smedley.
Thank you, Member Katsas. Yes, I would agree with Member Clodfelter. It is needed on the west side, so I'm glad to see this happening. What would entail other pedestrian improvements other than sidewalks? Just curious, what does that mean?
In this instance, I'm not sure. I did have a quick conversation with Jessica Adine today, but I did not want to take up too much of her time, as I know how pressed she is in her current job. So we can ask and try to get additional. I know that. Oh, Mayor Patterson. I'm sorry if you had your hand up for a while. I wasn't looking at the screen.
No. Member Cox, I didn't have it up for a while. I figured I'd help you out because I too have had a number of communications, not just with now interim director Jessica Dine, but also with Chief Pyle. And, it's long overdue that there needs to be a concerted effort to really make significant improvement.
Uh-oh.
I think what the mayor was going to say was that pedestrian improvements could include such things as marked crosswalks, improved lighting, even ped heads, pedestrian crossing signs at major intersections. If we identify them over on the west side, for instance, maybe State and Schaefer, something like that. So it would be more than just sidewalk improvements. So I'm not saying that we would ultimately spend the money and things other than sidewalk, but we would look at everything in a very, comprehensive way.
Thank you.
And I will mention that during my brief conversation with Jessica Dine today, that she mentioned that Paul Logue is also has been heavily involved in working on this project. So I would encourage any council member to reach out to those people to have those conversations if they want to learn more.
Yeah, we consider it a major investment on if we're granted the funding, major investment for the west side, and the mayor was alluding to that an investment on the west side is long overdue.
Okay, perfect. Member Grace.
Thank you, Member Katsas. I think this is really wonderful, and I look forward to hopefully the city receiving this grant and really finding out what possibilities there are for improvement. But your statement that this would need to be introduced and suspended next week reminded me I wanted to tell council that the ordinance regarding the funding for the base radio system will also need to be suspended next week because of the rapid rate at which their current system is failing. We do not want to be without a dispatch radio system. So I just wanted to take the opportunity to jump on your reminder about future suspension. So thank you.
Okay. Thank you, Member Grace. And just to give you a little update, Mayor Patterson, Chief Pyle did step forward and talk about some different elements that would be added to the to the west side if we're successful in seeing funding from this opportunity.
Thank you, Member Katsas. Thank you, Chief Pyle. I should probably add at this point in time, I am in desperate need of a new base radio station right here in my own house so that I can stay dialed in with all of you. I really apologize, council and the viewing audience, for whatever is going on in my household right now. But again, not to belabor this at all. Hopefully, Chief Pyle weighed in, on what I believe to be a long overdue effort into the west side to make sure that we're, making the sidewalk improvements, the lighting improvements, making curb cut improvements. There's a lot of things that are necessary down on the west side. And this is one of those efforts, is you're going to see a lot of improvements on West Washington in the not too distant future with the CDBG allocation that came through for that project down in that corridor. So just wanting to get that out there. Thank you, Member Katsas.
Thank you. And Member Fall.
Thank you. I just want to point out that a lot of the projects and ideas that are going to be coming forward in the next couple years have actually been talked about and had public meetings about them because they're in our comprehensive plan that will be coming out, our major update that that Paul Logue has been spearheading and working so hard on. So a lot of those public hearings have already been had, and that we have a starting point with a lot of interactive and a lot of conversations with neighbors and with those sort of things already because of that project. So thank you.
Perfect. Thank you. And with that, I am done with Transportation Committee. So thank you.
Okay. And I think we're done for the evening. And Director Pyle, thank you for staying with us through all of the discussion this evening. Your input's been very helpful.
Thank you.
And thank you all. We'll see you next